Assalamualaikum warahmatullahi wabarakatuh. My name is Ali Hafizi bin Awang. It's number matric 2211 451 401. Today, for my group, I will present for the case study A, which is total heat joint replacement for part A. This presentation focus on design concept, main component, design consideration, and biomaterial selection used in total heat joint replacement for the system. Total heat joint replacement is a orthopedic implant designed to restore heat, heat function by replacing a damaged or its one natural heat joint. Its main purpose is to reduce pain, improve patient mobility, and restore normal load transmission during the daily activity and as a walking and standing. The first, the key objective for the design is to first replace the diseased hip joint with a durable artificial joint. Second is to restore smooth articulation and joint stability. Third is to ensure a long-term mechanical performance and biocompatibility. And finally is to minimize the waste losses and implant failure over the time. Next, I will present a total hip replacement consists of four main components. The first component is a femoral stent, which is increased into the femur. It provides a structural support and transfer body load from a joint to the bone. Second component is a femoral head, also known as a ball, is a spherical component attached to a stem and enables smooth joint articulation. The third component is a acetabular cup, which is fits into the pelvis bone. This cup house is linear and form a socket of the joint. And lastly, final component is a acetabular liner. It is a place inside the cup and function to reduce friction and waste during the joint movement. Let's go to the design consideration and mechanical morphological. In terms of mechanical consider, the plan must have a high fracture strength to withstand the repeated circle loading. It must also have a active stiffness to support body weight by maintaining elastic modulation close to the bone to reduce the stress shedding. Additionally, high waste resistance is required at a articulation surface to ensure the long service and life. From the morphological perspective, the articulation surface must be smooth to minimize the friction. Focus and roughness surface used for promote the bone in growth. The implant shape must should closely match patient autonomy, and proper surface finishing is essential to improve the fixation and overall stability. Next, we go to the biomaterial selection in critical to ensure the performance and biocompatibility. For femoral stem and acetabular cup, titanium alloy T16AI and 4V is used. This material offers excellent biocompatibility, high corrosion resistance, high strength to weight ratio, and a posture surface that promote the isointegration. Second is femoral head. The second is femoral head is made from cobalt forming alloy due to its very high hardness, superior weight and resistance, chemical inert in body fluid and smooth polymer surface. The last is acetabular liner. It's functional for the high cross link UHMWPE. This material has a low coefficient and of friction, high wear resistance, good impact strength, and a long-term chemical stability. In conclusion, the design of a total heat joint replacement integrate mechanical strength, autonomical compatibility, and appropriate biomaterial to ensure a long-term functionality and patient safety. That's all for me, and thank you.
For the factor that contributing the failure of total hip replacement is first we have accepting loosening. Is the domain mechanism where the particle, especially from the bearing surface like polyethylene, trigger a chronic inflammation response. This lead to the bone resorption around the implant, creating cavities that compromise stability. The micromotion and failure osseointegration, insufficient initial stability of or biological factor prevent bone from growing into the implant surface for cementless stem or weaken the cement bone interface for cemented stem. Second, we have a patient-specific factor. For the younger age and higher activity level cause a higher mechanical demands, accelerating wear and risk of loosening and fracture. Then for obesity, which increased mechanical load on the implant and is a risk factor for infection and dislocation. Last one, disease that affect bone quality such as osteoporosis, kidney disease, or a healing like diabetes, vascular disease, and smoking. The third one, we have periprosthetic fracture. The periprosthetic fracture is a bone fracture that occurs around a prosthetic device that has been installed in the body, such as in the hip or knee, and it requires careful diagnosis because the metal can occur X-ray or MRI image. Next, we have approach to prevent total hip replacement failure. First, we have improved bearing surface material. One of the main reasons for hip replacement failure is wear and tear of the joint surface. Using highly cross-linked polyethylene, like ceramic on ceramic or ceramic on polyethylene, bearing surface reduce the generation of wear particles, which is a major cause inflammation and implant loosening. Why it help? Because the lower wear rate, the fewer debris particle, then the reduced risk of aseptic loosening. Second one is advanced coating for implant. By applying bioactive coating such as a hydroxyapatite, titanium plasma spray, can promote bone growth into the implant, enhance fixation and reducing loosening. What is help is enhance bonding between the bone and implant can make stronger and longer lasting integration. Lastly, we have antibacterial surface modification. The reason is infection are a significant cause of early total hip replacement failure. Biomaterials can be modified to release antibiotic or be coating with silver nanoparticles, chitosan or others antimicrobial agent to prevent bacterial enhancement and biofilm formation. Why is help is because the reduced risk of the post-surgical infection can lower chance of revision surgery.
My name is Shifa binti Habibullah with matric number 221151578. Today, we are discussing the biological safety of total hip arthroplasty or THA. While most hip replacements are highly successful, the 10% that fail within 5 years often do because of biological incompatibility or wear debris. We will look at how the ISO 10993-1 framework helps us manage the risk. According to the ISO, the first step is catheterization. The THA is implanted device in contact with tissue and bone. Because it is intended to remain in the body for decades, it is classified as category C, permanent contact. This is the highest level of classification which triggers the most rigorous testing requirement in the ISO metric. ISO 10993-1 has shifted from a simple test list to a risk management process. It is about being smart with data before we ever enter a lab. We start with chemical catheterization. We analyze extractables and leachables, essentially checking what chemicals might leak out of the metals or plastics. By identifying this early, we can predict toxicity risk without unnecessary animal testing. Finally, we conduct physical catheterization. For a hip joint, we must analyze the wear debris. We need to know the size and shape of the microscopic particles created by the moving joint, as these particles are the primary trigger for long-term inflammation and implant failure. This table shows the mandatory tests for a permanent bone implant. Beyond basic cytotoxicity and irritation, we must look at the genotoxicity and carcinogenicity because the device stays in the body for so long. We also perform implantation tests where we actually place the material in bone to see if the bone grows toward it or pulls away from it in a foreign body response. Beyond basic toxicity, we must address three specific clinical risks. First is wear debris. These microparticles can trigger osteolosis, where the body absorbs its own bone, causing the implant to loosen. Second is metal ion release. We must ensure that ions like chromium and cobalt don't reach toxic level in the bloodstream. Finally, we monitor mechanical integrity. If the material degrades or wears too quickly, it leads to revision surgery within that critical 5 years window. Our goal is to ensure the biological response doesn't compromise the mechanical fix.